Hey guys, I'm Elliot Mattingly. I'm a physical therapist with KORT in Bardstown, Kentucky. And today with me, I have Dr. Mark Duber.
I'm Dr. Mark Duber. Nice to meet everybody out there. Here to talk about total knee replacements with Elliot and everybody at KORT Physical Therapy.
I don't normally look like this, so happy Halloween, everybody. And I thought it was really important to talk about knee replacements since I have 8 legs. So this is how we're going to start it. We have a couple other people joining us today. We have Christine and Andrea. So if you hear some people talking in the background or asking us questions, that's who they are. But yeah, so we'll go ahead and start, hopefully, answering some questions that you guys have about knee replacements. And if you have any other questions, please comment below, and we'll get to those as soon as we can. All right.
All right, the first question is for Dr. Duber. Can you explain why you're passionate about orthopedic surgery and knee replacements in particular?
So orthopedic surgery is a very interesting field. I've always been very into athletics and being very active. So orthopedics to me, being a surgeon, fixing people who are trying to stay active, just goes along with my personality. So I've always felt at home in this field. And knee replacements, considering that I like to do things like bike and run and work out in the gym, they're really important. You have to have knees to walk. You have to have knees to be functional. They can cause a lot of pain when there's issues, and that's what we'll talk about today. You know, when someone's right or not right for a knee replacement, but that's just very important in the field that I deal with every day.
Elliot, can you explain why you are passionate about knee replacements?
Yeah, so I'm kind of the same way with Dr. Duber. I like an active lifestyle. I think there's so many things in this world that we want to see and activities to enjoy. And when you have knee issues like knee arthritis, it's really hard. It really slows you down. You have to give up a lot of things in your life. And it's so awesome that a knee replacement can give you those back. So, you know, Dr. Duber, he sets me up for a layup because he does a really nice surgery. And then I get a chance to give people, I get to finish that task. I get to help people get back to their goals, whether it, like you said, be hiking or biking or really just playing with their grandkids or whatever it is. And it's a really important piece of their life that I like to work with.
Yeah, and I'll also just add on that, I always tell my patients, 50% of your recovery is I have to do a good job as a surgeon, but 50% of the recovery is also the therapy and the patient's effort. So if one of us doesn't do a good job, it doesn't work. But if we both do a great job, then they have a great outcome.
Yep.
All right, the second question for Dr. Duber. I've been told I'm too young for a knee replacement, but I'm in pain. What is your opinion on age ranges for knee replacements? Can you be too young or too old?
So we'll address both the spectrums. So why don't we start with the too young? So first of all, I'll tell you that in today's day and age, technology has improved significantly. So if we went back about 20 years ago, we would expect that a knee replacement might last about 15 years. In today's day and age with the current technology, we tell people potentially up to 30 years or even longer. The materials have improved. So now we look at a young patient and we're looking at, did we exhaust conservative care? That could be injections, therapy, anti-inflammatories, activity restrictions. If we get to the point where everything else has failed, we have the documentation of the arthritis, we are doing these at younger ages now. So I would say an average age for a knee replacement is somewhere usually between 50 and 65 years old. We still do knee replacements at a younger age if need be. Some people have arthritis for many reasons. Some is just genetic. They've had bad joints that have just developed throughout life. Some people have had major injuries, car accidents, athletic injuries that developed into early arthritis. And if that pain is that significant and it's decreasing the mobility someone's having and the ability to do things they want to do, we do consider knee replacement at a younger age to take pain away. And most people can still be very, very active on those knee replacements during the lifespan of that implant. In terms of too old, it honestly comes down to how healthy you are. Your age doesn't really mean as much. It's about how healthy you are physiologically. How healthy is your heart, your lungs, your kidneys? What kind of diseases do you have? Do you have diabetes? Do you not? Is it controlled or not controlled? If someone's healthy, we do replacements for someone in their mid-80s. It just really depends on the pain they have and how healthy they are. And is that the best option for them? And that's a discussion we have in our office.
What I like about that is you choose to do surgery on somebody based on their potential for quality of life. If they're going through and they're seeing a significant decline in things they enjoy, that's the perfect reason to do the surgery. And I really like the fact that you don't let a specific number get in your way, because other times people have to wait until they hit an age when everything else could look the same but that number is what makes them have surgery now. And that's pretty frustrating, I think,
Absolutely.
especially as a patient, you know. So we really enjoy working with those people once again to get them back to doing whatever they want to do.
Yeah, we have to look at a patient in 360 degrees, all different aspects to determine, if they're a candidate.
Dr. Duber, you mentioned advancements in technology. Can you describe the tools and technology you use during surgery on knee replacements?
Okay. So knee replacements have changed a lot. So, I've been in practice now for about 13, 14 years or somewhere around there in that ballpark. So before we used to use just generalized guides. A lot of it was like my eyes looking at the patient, how I'm going to do the knee replacement, how I'm making certain bone cuts and putting implants in. And the way we do them today, we use something called computer navigation. So basically it's almost like having another surgeon with you looking over your shoulder saying, are you doing a good job or not? So when I do a knee replacement, I've got a computer that is showing me someone's knee in 3D, and it's showing me exactly what I'm doing as I'm doing the surgery. It's made me a better surgeon, and it's made it so I don't have to second guess anything. So it's also made it so that my outcomes are very consistent, and when I see someone in the office, I kind of know what to expect every time they come in postoperatively at the 2 week, 3 months, 6 months, and 1 year marks, and by 1 year we're kind of done with the follow-up. But computer navigation has made a significant difference not only in the accuracy of the surgery, it actually speeds me up too because I have less second guessing that I have to do with myself.
That's always a win.
Absolutely.
What I like about it too is that we can see a difference in therapy, because when we have somebody using the technology that's around, our jobs are so much easier. We get to do therapy without causing a lot of pain. Our goals happen quicker. We almost have to let time catch up with us because, so we have to learn to be a little bit more patient when we're progressing our patients, which is really nice. I would much rather have to play wait than try to catch up. So that's really, really exciting.
Absolutely. And, in the new technology, and I really focus on the efficiency at which I can do a surgery now. The more efficient I can do that surgery, the less time under the procedure where the incision's open, we decrease infection rate, and we decrease a lot of other issues that go along with it, such as DVT, PE, and other things where someone, is, under a tourniquet or not tourniquet and blood is pooling in that leg. So believe me, it's a very healthy thing to be efficient. So technology not only makes us do better surgery, but it helps us do it much more efficiently, which is much better for a patient.
That's great.
The next question is for the both of you. We can start with you, Elliot. Why is it important for my physician and physical therapist to work together?
That is it's a really important thing for us, and I'm glad that we have Dr. Duber so close to work with us because, treating a total knee replacement and just treating patients is a dynamic approach. Not everybody is exactly the same, and we have to communicate often to make sure we're doing what's best for the patient. And having a good relationship means I can shoot him a text or call, or sometimes just walk over to his office, and he still welcomes me with open arms to help take care of our patient, because that's what it's all about. And if we don't have a good relationship, then the person in the middle is who really gets affected.
Yep, and I would say, just kind of the follow-up, therapy is very important. Without effective therapy, both on the therapist side and the patient side, we don't have good outcomes. Outcomes are dependent on good surgery, good therapy, good patient effort. But in reality, the nice thing about having that relationship is there's a complication or anything a concern, there's communication, and we're preventing major complications by catching stuff early, whether that's a little bit of a superficial infection into the incision, but we're preventing it from getting into the knee. And if we don't have that relationship together, then that's something that can be missed and cause something catastrophic down the road.
For sure.
All right. The next question will start with Dr. Duber. Is there anything I need to do before surgery? Would I see a physical therapist beforehand?
So in general, we have something called prehab with any joint replacement we do. The healthier and stronger you are before the surgery, the healthier and stronger you are after the surgery. So someone's outcome, someone's recovery is much, much better if we're stronger in that leg, especially with a knee replacement. And I think that's more important for a knee replacement than even other replacements, because their strength is such a vital part of getting someone walking after that surgery.
Yeah. I think a lot of times when people come to therapy before surgery, they don't quite understand. They think it's a lost cause. They're like, well, I'm going to have a knee replacement. What am I doing this for? But you say it right. You tell your patients this, that the effort they put in before is going to make it easier afterwards. You want to come in with as much motion as you have and as much strength as you can gain, knowing that this knee replacement is going to be a challenge. So you try to set yourself up with the best opportunity you can, and that comes with a little work before.
Absolutely.
Yeah.
Absolutely.
So it's a huge commitment And it starts even before surgery.
Yeah, and if you rehab appropriately before the surgery, I would tell you that can cut as much as 2 months off someone's recovery because they don't have to work to get the strength they already have.
Yeah.
Following up on that, Elliot, what does post-op recovery look like for a total knee replacement? Is it painful?
Yeah, knee replacements are hard because there is a lot of pain that comes with it. But what's nice is that it's getting better and better. Once again, the fact that he does a computer-assisted navigation, that allows for more accurate surgery. And when people come in, we don't really have to do, what we used to. Like the whole adage of no pain, no gain is not quite what, we don't have to do that. You should be able to feel better each time you leave therapy. That doesn't mean you won't have some pain or won't have some discomfort, but there are so many things that you can do to decrease your symptoms and not even just have to depend on medication. So our post-op care is really involved in trying to get your motion back as quickly and safely as you can while we try to decrease your swelling and improve your strength. And like I said, it happens at a much faster rate nowadays.
Absolutely. And I can break that down even further from the surgical point of view, I would tell you that really most of the pain from a knee replacement is really in the first 2 weeks, the higher levels of pain. By 2 weeks, people are usually getting over and they're finally like, okay, I'm happy I had this done. I'm getting over this pain that I initially had. Then I would say the next time frame I look at is usually 6 weeks. At 6 weeks, people will normally tell me they're progressing well, they're feeling positive about everything. The swelling and the pain is just more of an ache, and it's something a little bit more constant, but it's very, very tolerable. The magic time frame in a knee replacement, honestly, is about 3 months. When you get 12 weeks from a knee replacement, most people are probably through about 75% of the recovery of that replacement, and that's when they're really happy they had it done. That's where people start telling me, I wish I would have done this years before. I was just concerned and scared about the surgery itself. In the last 25% of a knee replacement, that takes between the 3-month mark and the 12-month mark. So a little ache, a little pain, but not even something so much to tolerate much because it doesn't bother them that much. And then 1 year is complete 100% full recovery for an average knee replacement.
It's funny because usually at that 3-month mark, people are telling me that they've scheduled their next one.
Absolutely.
Things have gone so well, they're like, wow, I didn't realize how bad my other side hurt.
Absolutely.
Because this one feels so good now. So that's
that is correct.
The next question is for both of you all. We'll start with Dr. Duber. What are your goals for a patient when they come to see you?
So my goal, first of all, is to just address the problem itself. And by doing that, I have to diagnose the problem. So since we're on the discussion of knee replacement, that usually involves an x-ray, a physical exam, and really just getting to know the patient and what kind of effect that's having on their life. So if I can connect with the patient, find out what their goals are, put them with goals at which I can help them with, being a knee replacement. Sometimes it's just an injection. Sometimes it's therapy alone and anti-inflammatories. But I'm trying to look at what they're looking for, how much their life is being affected in a negative way, and how I can help that.
Yeah, and I think that's a huge point. It's just how does it affect their life, or who is the person that we're treating? It's easy for us to know what the problem is. A lot of people will come in with arthritis, but how is it affecting their life? And what is it affecting? Because if they aren't able to work and they have to provide for their family, or if they have little ones that they're taking care of, or there's all these different pieces that adds to our patient's history and our patient's story. And the fact that we need to connect with the patient's story to get them better is why I really like working with knee replacements and post-op, because it seems like it's cookie cutter, but there's so much that goes into it from the surgical side to the therapy side that it's really patient individual.
Yeah, and just to add on that, not everybody needs a knee replacement.
Right, yeah.
I mean, we have to understand that. So like I said, the basic conservative care that we use might just be an anti-inflammatory and people feel okay. Mm-hmm. And then, or does it need therapy? Does it need an occasional injection? Some people go years without a knee replacement, just doing those things alone. Mm-hmm. And it's only when all the conservative care fails that we actually start that discussion on knee replacement.
Yeah.
All right, we have answered all the questions everyone has had. If there's anything else you all think is important to tell everyone, or if you'd like to tell people how they can contact you and schedule a visit.
Yeah, so we're both together here. KORT is combined with my office here. So you can contact my office here at Flagey Orthopedics. We're a part of Flagey Memorial Hospital and St. Joseph Health. And then you can contact Elliot through KORT directly. Yeah,
so you can give us a call at 1-800-645-KORT. You can check us out at KORT.com. And right now we're trying to really provide a lot of options for our patients. So you can come see us in the clinic. We can use tele-rehab and telehealth. or we can come to your house too. We have rehab at home. So we want to make sure we're able to provide for you in this crazy time. So we try to create as many options as we can to be successful with that. So thank you guys so much for joining us. And if you have any more questions, please reach out. We look forward to working with you.
All right, nice to meet all you guys too. Have a great day.
Yeah, thanks guys.